this way?
Stage left.
I thought he said stand where you left it, not behind the
Stage
speaker.
left. House left.
Stage left.
You should notice they just had this in class the other day.
VIP.
Good evening. Kevin Captain, Interim Director of Community Information for Volusia County Government. Thank you for joining us tonight and together. We know that right now there are many questions and concerns. As you can see from the diverse group gathered with us tonight, the Volusia County community is working closely with its local partners as well as our state and federal authorities. As with all other local governments, we closely are monitoring the information provided to us by the Florida Department of Health. As we receive updates, they'll be posted on volusia.org/coronavirus. Before I invite the first speaker up, I'd like to ask that you hold your questions until the end of the conference, and we'll take questions at that time. With that, I'll introduce Volusia County Chair Ed Kelly.
Thank you, Kevin. And I guess, you know, we've become accustomed to being here for hurricanes. This is totally new to all of us. It's the first time that I think any of us have had to go through this. Kevin had mentioned that. And please understand, we are working very diligently at this time to make sure that you are provided all of the information as quickly as it's made available. As you know, yesterday, Governor DeSantis declared a state of emergency for the state of Florida. Earlier today, President Trump issued a federal state of emergency. In alignment with these declarations, we felt that it was important and appropriate that the county also issue a state of emergency. We're working closely with the Florida Department of Health, who is the lead agency for all testing of infectious diseases. The county is doing everything we can by cooperating with the local partners, government agencies, and we need your help. We need your help so that individuals will follow the recommendations set forth by the Department of Health. Wash your hands thoroughly and often. Avoid large gatherings. If you do not feel well, stay home and call your primary care physician first. Our website, volusia.org/coronavirus, has all of the latest information, and it's updated as soon as the information becomes available from us, whether it's a state or federal announcement. While we're doing all we can, please assist us by doing all that you can. And with that, I'll turn it over to County Manager George Rechtenwald.
Thank you, Mr. Chair. Good evening. As Kevin stated, we continue to work closely with all of our partners to ensure the safety and welfare of both our residents and our visitors. The Center for Disease Control has issued recommendations to the public to mitigate the spread of COVID-19, including canceling large gatherings exceeding 250 people. We are encouraged to see that the CDC's recommendations are being followed by many of our event holders. Following this recommendation, as well as the governor's advice, the county highly recommends that the public avoid these mass gatherings. As a county, we've taken precautionary measures both internally and externally. Sanitation measures have been drastically increased all across the county at all of our facilities and parks. We are prepared to adjust county operations to protect our employees and continue to serve the community. The Daytona Beach International Airport and Votran have increased their cleaning and are taking additional measures to remind the traveling public of preventive actions to reduce the spread of germs. We're working closely with our customers of the Ocean Center on bookings in the near future. And with the declaration of the state of emergency by the federal government, state and county, we are actively reviewing all of our county-controlled activities to act in the best interests of our citizens and guests. As Kevin also mentioned, our Public Information Network website has been activated. We can be found at volusia.org. This is the best place to find updated information from the county. City and agency information is also posted there as it's received. With that, I'd like to bring up Emergency Management Director Jim Judge, who will speak more to the local declaration of emergency and the preparations.
Thank you, sir. Good evening, everyone. As Kevin stated, we now have a local state of emergency, and that follows suit with the presidential declaration, the governor's declaration. So then, now it's our turn to put that local state of emergency in place. This gives us additional operating flexibility. So we suspend the normal purchasing practices that we go through on a daily basis. It just makes it easier to get goods and be able to stay on top of our supplies. If emergency needs arise, we're able to appropriate, again, those funds as necessary. Beginning today, the Emergency Operations Center will be going to a partial activation. We'll continue wrapping up that activation through the weekend and through next week. Questions regarding the COVID-19 should be directed to the Florida Department of Health's call center. I know you all have that, but 866-779-6121. And with that, now I'd like to invite Dr. Scott Fritz to come up with our Superintendent of Schools.
Good evening. Today at 4 o'clock, the Commissioner of Education and Governor DeSantos got all the superintendents on a conference call and enacted an executive order extending spring break by 1 week. The purpose of that time is to have our students not have be in crowded settings, to be away from their schools. They have canceled extracurricular activities for the next 2 weeks, including athletic events. We do have a pandemic academic plan, should we have to go beyond that time, that we could enforce so that we could have our students continue their education. We are still waiting on guidance from the state regarding things such as makeup days and graduations. But at this time, that's where we're at. We expect that to change over the next few days. As we get more accurate information, as it keeps being updated, we will certainly alert the public. And now, Derrick Henry.
Good afternoon. In congruence with the federal government, the state government, and now our county, we have made the following decisions as it relates to the city of Daytona Beach. Effective immediately, the city is suspending issuance of new permits. All individuals or private companies with events of 100 or more attendees are strongly encouraged to postpone or cancel such events. The city is suspending all city-sponsored senior citizen programs and activities. We're canceling or postponing all private and public community events at city parks and city-owned facilities with 100 or more expected participants. This includes events in venues such as Peabody Auditorium, Municipal Stadium, the Band Shell, Jackie Robinson Ballpark, and cities' community centers and recreational facilities. Effective at 8 a.m. Saturday, March 14th, the city is revoking all permits for outdoor events and activities related to Bike Week. Known cancellations and postponements include City Commission meeting scheduled for Wednesday, March 18th. In addition, I would like to comment or remark that we welcome to our city almost 10 million visitors each year. That is an astronomical number, and these decisions have been made with great thought and deliberation, but at the end of the day, it is about the safety of our residents and the safety of our visitors. So we want to also encourage young people who are preparing spring break, who are having extended spring break, to make alternative plans as it relates to this particular season, and preferably that they would choose another destination, preferably the destination of their homes. So in other words, we're asking that you not do as you have done in the past. You've always been welcomed. We will have bike weeks again, and certainly we will continue to have spring breaks in the future. But at this time, we're asking that you make a different choice and choose another destination. Thank you. And at this time, I would like to introduce Patricia Boswell with the Florida Department of Health in Volusia County.
Good evening. I'm Patricia Boswell. I'm the administrator for the Florida Department of Health in Volusia County. At this time of the news conference, we have 3 cases of coronavirus in Volusia County. All of these cases are associated with a Nile River tour. The cases include a 66-year-old female, a 60-year-old female, and a 70-year-old female. I do want to clarify, the last case was a female. It was previously reported as a male. Currently, there is no evidence of community spread of coronavirus in Volusia County. I'd like to explain what that term means, community spread. It means people have been infected with the virus in our area, including some who are not sure of how or where they became infected. That last part is key. We have been able to associate all 3 of the Volusia cases with international travel. Our epidemiology investigations told us where the cases were exposed to the virus, which was internationally, and not here in the community. Let me assure you that I completely understand the interest everyone has in having more information regarding these cases. However, the Florida Department of Health has to balance patient privacy with the responsibility to Floridians to disclose the information to protect the public. And so at this point, I cannot provide any additional information regarding these cases. We do have a web page and a phone number. The web page, floridahealth.gov/COVID-19, and a 24/7 call center, 1-866-779-6121. Again, that number is 1-866-779-6121. Individuals may also email covid-19@floridahealth.gov. Thank you, and at this time, I'd like to introduce our Sheriff Chitwood.
Good afternoon. On behalf of all first responders for Volusia County, I want to take the opportunity to tell people this is not a time to panic. This isn't a time to panic and lose common sense. This is a disease that we're asking you to use common sense and inform yourself. If there is an emergency, by all means, call 911. If you're not sure, call 911. Volusia County Sheriff's Office is doing everything it can to protect our employees and all first responders from the spread of the coronavirus. Starting Monday, what we're going to do in the county is, if you have a non-emergency police report, an example would be somebody broke into my shed, and there's no witness, there's no other physical evidence to be recovered, we're going to ask you to either come to a precinct to report it, or we're going to ask you to report it online. The objective, again, is to limit the contact that first responders have to only emergency calls. The non-emergency line that everybody needs to keep in mind is 386-248-1777. 386-248-1777 for non-emergencies. If you're in doubt, call 911. If you call with a medical emergency, be prepared to get a series of questions asked to you by the call taker. Some of those questions will include, have you left the United States within the past 14 days? Have you been in contact with somebody who has left the United States within the last 14 days? It's important we get as much information in the hands of first responders so that they can protect themselves and provide you with the level of care that you need. Remember, our job as first responders is to be there when nobody else is. It's our job to look out for them, to make sure that they're as protected and that they can continue to serve. Because if we get sick, we can't get there to help you. So again, I want to stress that if it's an emergency, call 911. In non-emergencies, we're going to ask you to either fill out a form online, or we're going to ask you to come down to a precinct where there'll be plenty of on-staff folks to take reports. We only expect this to go for the next couple of weeks, so we ask you to be patient, we ask you to be smart, and we ask you to follow the guidelines that are being put out by the Florida Department of Health, the Volusia County Department of Health, and by the CDC.
Thank you, Sheriff. Thank you to all our speakers. And
We care about the health and welfare of our public, and that is the county's #1 priority. As you can see, we're all taking this very seriously and working together in a coordinated effort to keep our community protected. And while we're doing all we can, we're also relying on the public. It does come down to one's individual responsibility. We need your help just as much as you need ours. Wash your hands as often as you can. For updated information, we repeat that you can go to volusia.org/coronavirus. You can also visit the Florida Department of Health's website and cdc.gov. With that, we'll open this up to questions to the individual officials, and we'll start now.
The president today, as you well know, declared a national emergency, giving $50 billion to states and territories to fight this coronavirus. What do you need here in Volusia County? If you had to, come up with a purchase list of things, whether it's PPEs, personal protection gear, or equipment, or whatever, what do you need in Volusia County?
Jim?
Great question. What do we need here in Volusia County as far as products that the funding wouldn't be made available? Right now, we are enhancing our public protection equipment. We have actually put some requests into our Web EOC, which is the software that Volusia County, all 67 counties, and the Florida Division of Emergency Management use. So we put some requests in for additional PPE just to make sure we've got plenty on hand, even as much as hand sanitizer, because that certainly has been a commodity that's not in great supply at this moment. So just a few items that we've put in for. We've got a great supply. The Health Department has a good supply as well. But, it's always good to be prepared, because should the situation come around, we're going to use a lot of that. So, better be prepared and have that product and, have it on standby.
Do hospitals and medical providers in Volusia County have testing kits, and how many?
So the question was, do hospitals in Volusia County have testing kits, and how many? Patricia?
So Governor DeSantis had a press conference this afternoon at 2 o'clock, and during the conference, he indicated that he has 2,500 testing kits that can serve 625,000 individuals to be tested, which he indicated in his comments that was more than any state had requested. So right now, the hospitals and the private doctor's offices are indicating that they don't have the kits readily available to them. And so we're working at the state level to ensure that we get more test kits into both hospitals and private providers so that more testing can be done at commercial labs. Now, the difference here that you need to understand is that the collection of the specimens are not being done at our commercial labs. So if you're going into a physician's office, you need to ensure if the testing is something that needs to happen, they have the capability to do that testing.
So at this time, there are a lot of people who are swarming to stores under the impression that stores are going to be shut down. And you mentioned that you guys are trying to keep mass gatherings down. So, there's with so many people flooding stores, hundreds, how do you guys plan to do that?
Where the recommendation is for people feeling ill to stay home and self-isolate while they're experiencing any illness. We have increased cases of flu right now. We see other respiratory diseases happening in our community. People are feeling the effects of different illnesses in addition to this particular virus that we're dealing with. So stay home if you're not feeling well. Certainly at this point, there's no indication that people cannot go to public places. It's the mass gathering that's being discussed tonight. Thank you.
Mr. Rice?
Yeah, I've got a question about at 8 a.m. tomorrow, that timing for Bike Week. Is that because you just declared an emergency, or is this something that could have been done 3 or 4 days ago that in other words, over the last 3 or 4 days, we've had tens of thousands of people gathering down on Main Street and other venues in the county. And I guess, should that have been done sooner?
Well, that's a fair question, but it was done in congruence with what the governor stated and as it relates to the county. So at this particular time, we felt that it was time for us to act as the governor suggested, and he suggested that we suspend or curb as many mass gatherings as possible. And certainly that is a mass gathering. And as you know, once Bike Week goes into action, it's in action. And the only thing we're doing is curbing the portion of it that we control as a municipality, which are, as you know, the licenses and permits.
But should it have been done
Well, that,
in retrospect?
in retrospect, I will allow you to make that judgment. As far as I'm concerned, I've made the decision in the city as it relates to the information that we've been given. But, you know, the journalists and the community will have to make that decision.
What specifically will that impact with the permits?
It will impact the permits that we've given as it relates specifically to itinerant vending. And so those are pretty much obsolete at 8 a.m.
But the bars, that sort of thing, they'll continue to operate?
Yes, on private property, those things that we don't have control over, yes.
Is there anything else on city property that would impact?
Well, it impacts, as I said, the Peabody Auditorium and the events that we have there. Anything that we harbor, yes, it would impact those things also.
So beyond revoking itinerant vendors' licenses and that sort of thing, do you encourage the bars down on Main Street, out on, I guess US 1 would not be?
Absolutely. I
Should curtail their activities?
Absolutely. I would encourage, and we have, and that's part of a broader statement from the city, that we are encouraging even businesses to discourage folks. But, you know, those are things that businesses will have to, decisions they'll have to make.
When it comes to the students being out of school for an extra week, is there going to be any help for parents in terms of childcare if they still have to work?
So the question is, with schools being out, parental help.
That question was actually asked on the conference call today, so we're waiting for some of that information. But again, going back, the idea is to not have a whole lot of people together. And this is a community event. I think everybody's going to suffer, including working parents, with this.
On the question of isolation, recently the secretary for the Agency for Healthcare Administration said when it comes to nursing homes and skilled nursing facilities, it's really going to be important to get the help of you gentlemen and ladies, EOC. If those facilities, if, God forbid, but if those people need to be isolated, some skilled facilities can do it, others can't. Do you have the resources? Do you have the beds ready, willing to go if they need to move to another spot and that nursing facility cannot handle those senior citizens?
So to repeat the question, it's about skilled nursing facilities and the preparations.
Right.
Preparations and
If they have to be
capability and
isolated,
capacity.
right.
So at this point, during today's press conference, Governor DeSantis did indicate that in Broward County, they were prohibiting all visitors to assisted living facilities and nursing homes and other skilled facilities. That's an example of what happened in Broward because of the number of cases that they have down there. So I would say that in our county, what we've done to date, and we've been working very closely with ACA on our efforts locally, contacting every facility, making sure that they have what they need in terms of hand sanitizer, all the things to keep the facility clean, make sure they have adequate staffing, that they're not dealing with any staffing shortages, and making sure they have a plan in place as what to do in the event. It's called a COOP, a continuity of operations plan, and going over that with them. And then giving them our contact information so that if they do see something happening within their facility, to contact us immediately. And right now, there is a sign on the doors of nursing homes and assisted living facilities requiring that all visitors sign in and they're checking their temperature.
But what I'm saying is, in the event that there has to be a self-isolation and those facilities cannot house for that reason. In other words, I'm a patient, I stay at XYZ nursing home, but for some reason, there's a number of people who need to be self-isolated, and I don't have the capability to do it at this particular place. Do you have the beds or capacity elsewhere to house those patients in the event of something like that?
Yes, so I'll ask that question again. The question was, in the event that there was a patient in a nursing home or assisted living facility that required
Self-isolation.
isolation, would there be another facility for that person to be housed in? So we have a plan in place with emergency management to use another facility in the county if there was a need for separate beds for people that needed to be self-isolated. Do you want to talk to that?
Yes, Patricia, let me help out with that. Also, the Division of Emergency Management, we review all of their plans every year. Every facility has a comprehensive emergency management plan. It has to have fuel, they have to have certain supplies on hand, they have to have transportation resources if they're going out of county. They also have to have sister facilities that they work with. So those comprehensive plans have worked very well through hurricanes. We're certainly going to see how they work through this episode, but we're there to support them. So with emergency management, with emergency medical services, our hospitals, and our Department of Health, we're there to back them up to do what needs to be done should we come into that situation with a patient that needs to be isolated. A lot of resources, a lot of support, a lot of communication. So, we're ready to deal with it if we face that problem.
We'll take a couple more questions.
Back to the kids being out of school an extra week. I know you said that they're working on a solution for childcare, but do you have a timeline? Like, are you guys having another conference call tomorrow? And will that conference call be available to the public and we listen in so parents are clued in?
So the question is about a timeline for childcare while school is out.
And as you guys discuss this, is that
Situational
something that's going to be open to the public where parents can listen in?
Now, the calls that I'm on are actually a superintendent conference call, so you have to be a superintendent to be a part of that conference call. But we've been working with our PIO to get that information out very quickly, and she sits in those calls with me. The question is whether or not there will be childcare. At the school sites, there will probably not be childcare. We've had extended day programs, but we have to look at the numbers. It depends on how many folks we actually have showing up. If we're over that recommended number, it would just be like a regular school day. This virus doesn't know the difference between an extended day program or an academic day. So we have to make sure that we're following the best recommendations going forward on that. We are sensitive that parents are going to be inconvenienced. But again, this is a community problem. And so if you work in a facility that has 1,000 people, those type of industry and organizations are facing the same struggles that we are.
I had a quick follow-up question on the test kits.
You were waiting in the back. Go ahead.
Yes, my question is for the mayor. Neighboring counties have, really suffered, the economic impact, especially like with Bike Week and so many people coming to Daytona Beach, for instance. Is there a ballpark figure in terms of how much Volusia County, has lost as a result of the decisions that have been made?
Has lost or will lost, but in either case, it's way too early for us to make any determination of that nature. And quite honestly, it's sort of above my pay grade. I really don't get into the economic weeds in that way until after the fact when the economists give us those answers.
I had one more question for Dr. Boswell, which is that when the first two coronavirus cases here were announced, and we tried to find out information about where they had been outside of country, we were told that that information either wasn't available or wouldn't be made available due to HIPAA concerns. And so far as I know, the HIPAA law doesn't have that concern. But we also, nobody knows where these people live. We don't know if they live in West Volusia, East Volusia, and absent somebody saying that, people are posting things on social media, et cetera, that we then are using to try to ferret that out. Why can't the Department of Health at least say that they live in East Volusia or West Volusia? Why in the past couldn't they say this is where those people were, but now they can't?
I would like to correct, I'm not Dr. Boswell, it's Patricia Boswell, so I want to make sure that that's corrected. Thank you. Thank you for that. And I want to repeat the question, and that is, why could we not disclose more information when the first two cases were disclosed, specifically about where in the county they reside? And so again, we're part of a Florida Integrated Department of Health, public health system. And we are basically practicing this across the state. Our Surgeon General, who's our health officer, has shared with us the guidance that talks about how to protect this. It's a balance. And maybe it's easier if we talk about HIV, something that we're all very familiar with and we have lived with for decades. We don't disclose who is infected with HIV. The same thing, I've never been asked where a TB patient lives, but,
Let me just push back on
okay.
that for a second. With HIV, the State Department of Health puts out by zip code where people live who have contracted HIV or full-blown AIDS. You can get that in a big database across the state. So why would it, like, for example, 32114 has the highest level of HIV in the county? So if that's the case for HIV, why, there seem to be a different set of rules for people who they've identified as contracting coronavirus?
Well, I think it's not a different set of rules, and that HIV, it's data, and it's about rates and number of cases. This is about an epidemiology investigation. And so when you're doing an investigation, you need to protect the individuals involved in that. So for example, when we were doing the first test, that test went to a state lab in Jacksonville, and it was considered a presumptive test result. Then from there, it goes to CDC for confirmation. So we need to be very careful about information and then protect individuals' information. So in terms of the residents, that's not information that the Department of Health in Florida is sharing in any of our counties. Now, in terms of the travel-related, we'll provide that, the gender, and the age.
But following up what he says, what about our protection? Don't we need to know?
If somebody is, and I'll repeat the question is the public safety component of this, and why doesn't the public know for their own safety? Individuals are self-isolating. They're staying at home for 14 days. We are checking on them and monitoring them and making sure that they have what they need to stay at home. That is the measures that are taken at this point. Everyone's been 100% cooperative in terms of the way they're self-isolating.
You had a question up front.
For the test kits, did you say it can serve 625,000 people? Is that statewide or Volusia County?
Statewide, according to the governor's press conference today.
Any other questions? Okay, with that, we will close this conference. We thank you for joining us with us tonight. And again, we're concerned about the health and welfare of all our citizens and visitors. And please continue to follow the guidelines of the Florida Department of Health and the CDC. Good evening.